In terms of unmet needs, I would say it's probably around the kind of organisation of care, and care experience being poor as a consequence of that. So I think I'll give an example in primary care at the moment, and I think this is what needs to change, where we're sort of driven by, I guess we're driven by the funding model, which kind of supports an idea that each disease is kind of managed separately. So a patient will come in for their diabetes review one week, and then the following week they might see somebody else for an asthma review, and then the following week they'll see somebody else for something else. So it's not very joined up, but we have the potential for joining it up, but the funding model at the moment doesn't particularly drive that. So I think that's a challenge for patients. Anybody living with multimorbidity is like to have quite disjointed care. Bits of it may be happening within hospital setting, bits of it in primary care, and then we have problems with kind of communication between the different sectors. So communication is often a problem. We don't have one patient record across secondary and primary care. So there's all the challenges around that. So I think the kind of biggest challenge for anybody living with multimorbidity is that fragmentation of care, and nobody really looking at the whole picture. I think that the potential in primary care is to see that whole picture, and when it's done well in primary care, I think we do that. But I think with workforce pressures and the way our care is organised at the moment, there's a lot that we can do to improve that. The long-term conditions strategy, the major condition strategy, which was launched this year, I think is quite interesting. It got launched without much fanfare and without much attention in the press, but actually I think there's some real nuggets in that policy in terms of how we provide more integrated care. And I know there's many in the sort of cancer community that feel that cancer's, by lumping it together with other long-term conditions, has been disadvantaged. But I see some real benefits of that more integrated approach for patient experience and outcomes. So I think the direction of travel, if we can think about multimorbidity in a more holistic way, rather than thinking about the specific diseases, is going to be better for patients. Because for a patient, if they've got a symptom, they're not that bothered about whether it's the diabetes or it's the cancer treatment or it's something else that's causing that symptom. What they want to do is resolve it. So, focusing on what matters to the patient, what they're experiencing, and thinking about how we can manage that with them and support them to manage it is going to provide better outcomes for them, I believe.